Hey everybody, welcome back. In this video, we're going to go and look into labor and birth. So it's really important that you watch this video because our textbook actually gives us some wrong information. The process of labor, birth, and birthing the placenta, the book calls that the 3 stages of labor, and that's not actually 100% accurate. Labor is the process of the cervix opening or thinning and opening up to 10 centimeters, while birthing deals with the baby actually moving through the birth canal and out of the vagina. And then the third stage is dealing with birthing the placenta. So let's talk about this a little bit. Before we go into labor with our Pine Street baby, we might have some Braxton Hicks. So Braxton Hicks are contractions of the uterus that aren't actually into labor. They're little practice contractions so that our uterus can be successful when we're actually going and birthing our child. So there are 3 actual stages of labor that we'll talk about. The first stage is called latent labor. The second stage is called active labor. And then the third stage is called transitional or advanced labor. In the first stage of labor, or the latent labor, this is when we start having some real contractions, but they're really irregular. They can go from 5 to 20 minutes apart. This is when effacement starts beginning. So effacement is the thinning of the cervix. If we remember from our readings, the cervix is the bottom part of the uterus that is actually plugged up with something called a mucus plug, which is like a little gelatinous material. In fact, many women will lose their mucus plug before they go into actual labor, and then they'll just see it after they've gone to the bathroom. It looks like someone put some clear Jello in there into the toilet. That's probably more information than you wanted to know, but that's the story and I'm sticking to it. So during this process, in the beginning of latent labor, the contractions are super irregular. They can be like one contraction could be you have it and then 20 minutes later you have another one, and then you might have one in 7 minutes, or you might have one back and forth at different times. As you progress through this first stage of our labor, you'll start to see, typically in a typical labor, you'll start seeing that the contractions slowly start getting into a rhythm, and then the time in between those contractions starts to shorten quite a bit. So once the uterus is opened up to 3 centimeters, we move into the second stage of labor, which is known as active labor. This gets a little bit more intense. It lasts typically between 2 to 3.5 hours, and this is when the cervix opens up to about 7 centimeters. So this is usually when people who are in labor show up at the hospital. Contractions can be 3 to 4 minutes apart typically. The contractions start having more of a peak to them, where there's a peak pain and tightness in the abdomen. And then, so this is also a lot of times when people, if they're wanting to use some sort of medication for pain management, you'll start seeing them get the epidurals or some sort of IV medications. This is also often when you'll see a lot of the nursing staff connect the people in labor with a monitor that goes around the belly that monitors the contractions. So you can actually see them on the monitor. You can see when they peak and go back down, when it relaxes, and how far apart they are. And then they also usually connect another kind of belt-like thing around the belly to monitor the fetal heart rate. And that's really important because if the baby gets super stressed out, sometimes some things can happen with the heart rate, and that might indicate that they need to prepare the person to have a cesarean section. And there's some things that they have to do that, and that can be really scary for some individuals. After we get up to 7 centimeters, then we move into something called transitional or advanced labor. This is the most intense part. Typically, this can last anywhere from 15 minutes to an hour. These are just some typical ranges. Definitely all this can be different for an individual, but the typical range is 15 minutes to an hour. This is when the uterus opens up all the way to 10 centimeters, and the contractions are typically about 2 to 3 minutes apart. The contractions get longer. They can last about 60 to 90 seconds. And then when the person fully dilates to 10 centimeters, it gives them kind of a weird sensation where they feel like they have to push or go to the bathroom. And this is usually when they start pushing. Hopefully, the doctor or the midwife or nurse practitioner or the doula, whoever is going to coach the person through the birthing, is preparing to help them push. So stage 2 then is birth. This is when the baby starts to move through the vaginal canal so that they can be birthed. Hopefully they are head down. Usually that typically happens earlier on in the pregnancy because if the baby is bottom down, the doctors will often try to get the baby to flip, and if they can't do that, sometimes they'll have a C-section because it can be really painful or babies can get stuck. And so once the baby moves down and the baby starts to crown, so that means the head is at the fullest part with the vagina around it. They call this sometimes the ring of fire because it hurts really bad, and sometimes people feel like they can't push through it, but they do. The person's down there to catch the baby like it's a football. Head goes out, shoulder goes out, and plop. Baby is out. Hopefully got caught. It's not on the floor, right? And the baby's born. Sometimes the scariest thing after birthing a child is waiting to hear that child cry. Because if the baby cries, that means that they can breathe. And so after that, it's not done yet. There's a third stage that gets left out quite a bit. So after birthing the child, it's time to birth the placenta. And you birth the placenta. Remember, we're talking about a normal vaginal birth. Yes, of course, there's other things that happen like C-sections, but this is just talking about a normal vaginal birth. And when this happens, the body contracts and tries to expel the placenta. Doctors will help try to kind of catch it and pull it out almost, and it feels like everything's being taken out of you. And so it's really interesting because sometimes, all the time, the doctors will inspect the placenta to make sure that it's still intact and that there aren't pieces left inside, because if there are, they can get infected, and that can be a really, really bad thing. Sometimes if the pregnancy has gone too long, the placenta actually starts to deteriorate, and that can be a problem as well. So that's what we have for it. Let me know in the comments if you have any questions.